Thanks, Joe. Well, welcome to everyone across the US and probably a big Minnesota contingent. We'll make sure that we try and have our comments apply regardless of where you're living across the US. So as Joe said, my name is Rajean and I work at the University of Minnesota, and my colleague, Liz. Would you like to
Hi,
introduce?
Hi, everybody. My name's Liz Lightfoot, and I'm with the School of Social Work at the University of Minnesota.
And we're here to talk a little bit about caring in times of uncertainty, helping adult children of aging parents find support. In the current pandemic related to COVID-19, we know that older adults are disproportionately impacted by the coronavirus. And we want to talk a little bit about what that means, talk about what it means in senior care and what's been happening across the US for older adults. Liz, anything else you want to say before we jump in?
Yeah, I say we'll also tell some personal stories. I think Rajean is really the expert gerontologist of the two of us, and I'll more talk about my experiences as a family member.
And we're pretty flexible. If you have questions, you can go ahead and put them in the chat or in the Q&A feature, and we might answer them as we go along. Otherwise, there will be time at the end to get back for those questions. We do want to start out and just with a quick disclaimer that Liz and I are not here to provide mental health or medical consultation or advice, but we would really recommend you contacting your healthcare provider if you're concerned about your mental health or your health. So just a little disclaimer there. So we are really glad that you could join us today. You likely are one of 41 million family caregivers that provide over 34 billion hours of unpaid care each year. That's estimated to be worth over $470 billion. As former First Lady Rosalind Carter is famous for saying, there are only four kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who need a caregiver. So at some point, we will all have some type of interaction in a caregiving role. And just personally speaking for myself, my father, when my mom passed away 6 years ago, decided to sell the family home here in Minnesota and move to Sarasota, Florida. And during all of this epidemic, managed to have a stomach virus that led him in the emergency room right at the beginning of COVID about 3 weeks ago. And he was in the hospital for 4 days. And caregiving at a distance can be quite difficult. So Liz, you want to talk a little bit about your experience?
And so I've been really interested in this personally because I have a mom who lives in a assisted living facility in Washington State where the earliest known outbreaks were of COVID-19, and it's been 6 weeks since they first had COVID-19 in their facility. And so I've been trying to advocate for changes in state policy and in the institution policy since mid-March, and also have run a few different support groups for caregivers who have family members in long-term care. So I've been picking up information and learning what people need and what people want and what people's really big concerns are in different locations.
Yeah. So sometimes when we think of older adults, we think of those living in institutions, particularly when we hear about COVID-19 and how impactful it is. It really focuses on senior care, particularly with those frail seniors that are experiencing chronic conditions. But it's important to note that COVID-19 impacts older adults regardless of where they live. And as I said, it disproportionately impacts older adults, and Liz has some statistics on that in just a little bit. Regardless of whether these older adults are living at home in the community, live in an assisted living, or live in a nursing home. And Liz, if you could click a couple more times, there you go. In Minnesota, these are just numbers for us, but they echo numbers all across the US. In fact, there are approximately 750,000 older adults living in the community. There are 40,000 people living in assisted living. Assisted living differs widely from state to state. In Minnesota, we actually are a low regulated industry. We did just pass new assisted living licensure laws Most states do have some form of assisted living license. We were one of the last states to require that, but it can differ widely from state to state. And in Minnesota, like I said, about 40,000 people live in what we would call assisted living. And then you've got nursing homes. There are in Minnesota around 27,000 people that live in nursing homes. And nursing homes are pretty much similar across the US because they're regulated by the Federal Centers for Medicare and Medicaid Services. They are licensed at the state level, but because the federal requirements are tied directly to reimbursement and being paid, there are pretty universal requirements across all states for nursing homes. And the little adage that's often said is that nursing homes are the second most regulated industry after nuclear power. But those regulations don't actually directly relate to the quality of a person's life. They relate to things like the temperature that food has to be cooked at, or the temperature that clothes have to be laundered at, which really doesn't actually impact a person's quality of life. It impacts their health and safety. So next slide, Liz.
Oops, sorry, I went ahead. So this is mostly Minnesota statistics, but I have been following this nationally. And so one thing to know about Minnesota is we in Minnesota are the best at social distancing in the country. And there's jokes and theories about this, that maybe it is because we live in the winter and we're used to staying home, or that we've got a lot of people of Scandinavian descent and we like to keep our distance. I'm not sure what it is, or that we are progressive and follow rules and care about seniors. It's not clear what it is, but in any case, we instituted social distancing earlier than other states compared to how many cases we have. So we trend older in a way. So our median age of COVID-19 in Minnesota is 49. The median age of hospitalized cases is 63. The cases in ICU is 64, and the average age of death is 83. This is higher than across the country. Long-term care settings, though, in particular, are seeing this huge surge nationwide. Oh, I left out the date. To just have April here, not April, what date? As of, this was last Friday, whatever date that was, there were 11,000 deaths in long-term care facilities in the United States. 11,000. I mean, it's really staggering. It's about 1/5 to 1/2 people are estimating in there are the number of deaths. And part of the reasons we don't know is you can see there's the gaps between how many are reported as COVID and how many expected deaths there are. Lately, people have been saying that they're thinking that about half of the deaths are from people living in long-term care facilities, congregate care facilities, and some people are talking about, we're putting all this effort into COVID-19, but we're not putting half our effort into thinking about how to protect people in long-term care facilities. In Minnesota, 25% of all cases who are thought to be exposed in the long-term care facilities. So these are generally from workers bringing in COVID-19 into the facility, and then it's spreading within the facility. And 19% of current cases are residing in long-term care. The reasons that this can be lower is a lot of them are in the hospitals now. So they're just counting who's actually staying once they're tested positive. And in Minnesota, it's now 79%. This is what's way higher than the national average. We have 79% of our deaths in Minnesota are from long-term care facilities, so about 4/5, which is much higher than the national average because of the reasons I was saying before. And we can talk about this later, but all states are now required to have a public posting of what facilities have COVID-19. In Minnesota, they've interpreted this rule to say facilities that have 10 or more residents, so it doesn't cover those family group homes where people are living. But there's 121 in Minnesota, and you should be able, those of you in other states, to go and find a list at your state Department of Health of all the facilities that have at least one positive case. And it was only last week or like a week and a half ago, that nursing homes were required to even notify and report. So there's been a lot of talk about this in our state and across the country about how caregivers sort of feel in the dark about what's going on, because there was no requirement that nursing homes or assisted living facilities would have to tell the family members or the residents themselves whether or not there was COVID-19 or what the extent was in the facility.
So when the CDC and state departments of health recommend interventions and prevention strategies for COVID-19, it often relates to where people live. So people living in their in the community, in their own home, should stay at home. Many of us are in states that have stay-at-home orders, some of the strictest states being California. Minnesota is also one of them. Some of the states that have started releasing some of those restrictions, including Georgia, which I believe recently is essentially removing most, if not all, of their restrictions. Texas has begun to significantly ease their restrictions as well. Even after any stay-at-home order is lifted, older adults and those with compromised immune systems should continue to stay at home. We know, again, this impacts older adults very differently than most ages. And when they're staying at home, older adults should practice social distancing and use strong infection control procedures. I'm sure many of you who have gone to a grocery store to pick up food or other essential items may see some of the grocery stores limiting the number of people coming in. Some of them have special hours in the morning for older adults or people with compromised immune systems. And some of them even are putting little stickers and tape on the floor to designate what 6 feet looks like. So I think that social distancing is going to be very critical. Assisted living, as I said, is regulated differently state to state. And in Minnesota, we have very low regulations currently. You know, again, this is going to change in Minnesota when the new license goes into effect in 2021. For now, assisted living providers are being asked to use nursing home practices. These are voluntary, but they are so important because assisted living are serving more and more people with severe chronic conditions and cognitive impairment, including memory loss, like dementia, Alzheimer's disease, and other forms of dementia. They actually are functioning in some ways as a nursing home these days. And so it's so important for assisted living facilities to really take nursing home recommendations under consideration. Liz, I think you're going to cover nursing homes and the little Easter bunny rabbit.
Yeah, the Easter bunny rabbit I thought was funny. This was sent to me. This is a photo of the Easter bunny visiting my mom in her assisted living facility with the mask on. My mom thought this was very funny. So the nursing homes, I mean, part of the problem with nursing homes is that the state departments of health, or the facilities, follow the rules of the state departments of health, who follow the guidances from the CDC as requested by the Centers for Medicare and Medicaid. And the CDC had very slow response to COVID-19 in nursing homes. So their initial responses through, you know, in March, and actually all the way through early April, was to request or require social isolation of people living in nursing homes. And this is essentially quarantining in rooms if possible. Now that's easier said than done, especially in assisted living facilities such as my mom's, where people can get up and walk around. And my mom is very social. So she, even though she's supposed to stay in her room, she opens the door and walks down the hall to go look for people to talk to. But the idea is to try to have quarantining in rooms. And if there are people who have tested positive for COVID-19, to have them in cohorts, which means have them stay in special wings or floors or sections of their facility, and have workers, well, that's the co-wording part, is having people live together, so to try to stop the spread. And then also to screen workers and residents for symptoms. And so how screening was typically done is when workers came to work in the morning, they'd take their temperature and ask them if they had any symptoms of COVID-19, a dry cough, you know, all the other ones. And that was done every day. And testing was only recommended for symptomatic residents and workers. And the problems with this, if anyone is following, you know, how COVID-19 is being spread, is that we knew really quickly that it was being spread by asymptomatic, or they're now calling them pre-symptomatic people, or people who don't have symptoms. And it can be, you know, a number of days, and there's some people who never develop symptoms, or don't develop symptoms strong enough to be noticed. And so the thought is now, when they've done studies of those early nursing homes in Washington State, where they had their first big, you know, widespread hotspot, is that it was workers coming in and out and going from facility to facility, because a lot of folks are working part-time jobs. So it's only recently, within, you know, less than 2 weeks ago, that they've upped their recommendations here to include masks. So masks weren't required or recommended by the CDC. And so even in Minnesota, there weren't people wearing masks until fairly recently. And we know that masks, people are symptomatic or asymptomatic with COVID-19. If they're wearing a mask, then they stop the spread quite a bit. Now they're also recommending separate teams. So when they're doing cohorts, actually having separate teams of people who are only working with those who've tested positive, because before people were going back and forth between them. And that's pretty typical in a nursing home or assisted living facility, where people are assigned to a certain group or whatever community in a facility, but then they also help out down the hall. So they're trying to stop that. And in lots of states, they're coming up with separate facilities to transfer people to who have tested positive for COVID-19. They're finally recommending facility-wide testing and doing procedures such as sentinel screening, which trying to find out where COVID-19 first came into a facility, and figuring out where it's spreading to try to contain it. This isn't happening that much in Minnesota. There's some states that are requiring, or the governors are coming out and saying we're doing facility-wide testing of all nursing homes, but this is not the common activity going on in states. And then finally, like I talked about from before, is disclosure. And that is that facilities are required to disclose within 12 hours now if there has been a positive case. But as we just saw today, those of you living in Minnesota, that that's still sort of vague. And so they're not disclosing necessarily how rampant COVID-19 is within a facility or how many people have died within a facility. They're just required to notify that there is COVID-19 in a facility. So that's sort of the state. This is changing all the time. Every time we do this talk, we have to update this because the rules are changing, the environment is changing quickly.
And yesterday, the federal government just announced that they'll be sending 2 weeks of personal protective equipment to long-term care facilities across the US, finally, after. Yeah. However, some of the facilities are anticipating this won't be available to them until mid-July. Right. And 2 weeks of PPE in a pandemic is not going to do, a lot of good. So, but they're helping as much as they can. So we get a lot of questions about some families would like to have their loved one close and may have the ability for a person to care for that person at home. But before doing that, it's really important to think about answers to these questions that you see on the screen now. These questions were obtained from Next Avenue, and they're offered by experts, geriatricians working in the field, and really are good guideposts to help you think about, should I bring my loved one home? So the questions to ask yourself is, can you get appropriate care outside the facility? People are often in assisted living and nursing homes because they do have chronic conditions that require 24-hour supervised nursing services. Are you going to be able to provide that at home? If your loved one does leave a nursing home or assisted living, will they be able to return later after they potentially have had the disease or there is a vaccine? What will the impact be on your broader family? It's one thing to say, I'm going to bring mom home. It's another to realize that your children now are also going to be at home because they're not in school. You may not have enough rooms or enough beds. How well can you control infection risk if nursing homes are not able to get personal protective equipment? How easily are you able to do that and use infection control strategies? And then lastly, to ask yourself, how accessible is your home? Again, if people have a limited mobility or transferring issues, are you going to be able to use wheelchairs or move people around your home? Some questions that you should ask the facility just to help yourself is, what is their quarantine, cohorting, or prevention strategy policy? That includes looking at their infection control procedures. The federal government has essentially suspended investigations, which are called surveys of nursing homes. Nursing homes are required to be surveyed. The surveys now are just going to be for those immediate jeopardy cases and are going to focus solely on infection control and COVID-19. How often are people being screened or tested at a facility? In Minnesota, our governor was able to work very closely with the University of Minnesota and the Mayo Clinic, and we're able to now do tens of thousands of tests every day. Other states don't have access to those providers, and the limited role that the federal government is taking is really pushing this on states to have to negotiate themselves to do testing. Again, the question to ask the facility, what will happen to older adults that move out and recover? Will they be able to move back in? And then lastly, if you do make the decision, you really need to understand the comprehensive care needs of your loved one before you bring them into their home. How are you going to get medication? Because medication is often included as part of a package of fees. If they're on a program like Medicaid in a nursing home, it's all covered. How are you going to get medications? How are you going to ensure that they receive things like wound dressing, appropriate transfers, and those social interactions? Liz, did you want to talk a little bit about your thoughts with your mom?
Sure. Yeah. Well, when I first heard that my mom was when we were notified that there was COVID-19 in my mom's facility, my first reaction was to hop on a plane. That's when you could still hop on a plane without worrying, and fly to Washington State and put her in my car and drive her all the way back to Minnesota. My mom is 90 and has pretty serious dementia. She can't walk up and down stairs. She uses a walker. But I was really afraid. And luckily I'm friends with a lot of gerontologists and other smart people who sort of talked me out of this, asking me some of these questions. And some of, so I was, I live in a house. I've got my two daughters from college home from me. My house has stairs to get in, all of the things Rajean was talking about. I have a full-time job. My mom needs 24-hour attention. How would I be able to do that? And how would I be able to keep her safe? But the other question was also about her quality of life. And she had been living in her assisted living facility for a while and is used to it and comfortable with it. And this would be a huge disruption for her to move across to country to live in my house, which is my inaccessible house, without people who are trained to take care of her. And so I was eventually talked out of it. I have to say, I'm still not entirely sure if this was the best decision. I still have this urge to do it. But one of the big questions that influenced me was, I know that someone in her facility who did get COVID-19 and recovered from it was not allowed to come back into the facility. And my mom has been so well cared for in this facility. I also thought, like in the overall picture, her staying in this place that she feels good was the best decision.
Right. So what can you do as a caregiver? This is a stressful time. Stress can lead to depression. It can lead to burnout. In 2000, the federal government expanded the Older Americans Act to offer services specifically for people like you, for caregivers who are caring for an older adult, whether it's a friend or family member. They did this by creating a network of service providers across the US that are specialized in helping you be the best caregiver that you can be so that your loved one can get the best services and the highest quality life that you're able to provide. Some of the services that are available are listed on the screen. Respite care, which is literally time away for you to do what you need to do. Grocery shopping, go for a walk. Often it's done by a volunteer or a paid staff member spending time with an individual. Another type of service is adult day services. You'll notice that we have that big no sign through the adult day services. In Minnesota, the 225 adult day services were closed in response to COVID-19. And so in your state, those services may also not be available. There are support groups, coaching and counseling. There are individuals that have been trained specifically on working with caregivers to understand and recognize some of the signs and symptoms of caregiver stress and ways to help you alleviate that stress to be the best caregiver possible. And lastly, there's education about any of the chronic conditions that your loved one may be living with, such as Alzheimer's disease or Parkinson's disease, and you can reach out to those specialists. I have an example on the next slide of a nonprofit organization that provides these services. This is just one example of a nonprofit provider here in Minnesota called Family Means. They're based in Washington County on the border of Wisconsin. They also provide services in Western Wisconsin. This is typical of services all across the US. And I'm sure that there's a service near you that you can tap into. And I'll give you some tips on how you can find that service. And I'll give you tips on how you can find these counselors that specialize. So this is a picture of Family Means, as I said. They have transformed their caregiver services to continue to provide services. For example, they're doing caregiver consultation over the phone. Their clients for their adult day program have been receiving individual calls to ensure that their needs are met. They're also not able to go into people's homes, so they're providing respite care over the phone. People often wonder, how can you provide respite care over the phone? Well, one volunteer actually found a movie on Netflix that she thought that the care receiver, the person with a mild form of Alzheimer's disease, would like, and they both watched it at the same time while they were on the phone so they could talk about the film. The person was engaged, was interested in the film, and that gave the caregiver a break of a couple hours to just breathe, to just think about something else. There was someone there on the phone that could contact them if there was an emergency, and it worked out perfectly. So they're expanding this. They also have had YouTube videos that staff created because the participants that are coming to the adult day program have lost their routine. And to be able to see the staff on a YouTube clip speaking to them, talking about how they're missed and that we'll soon be back together, and has been very, very helpful. Across the US, there are these new phenomenon called memory cafes, where a nonprofit provider partners with a restaurant where once or more a month, they offer a lunch specifically for caregivers and people with dementia. Obviously, in Minnesota and many places around the country, restaurants and cafes have been closed. They're doing them via Zoom so that people can participate and still have that support group. They're also doing coffee breaks. Staff are setting up time when people can just join a Zoom meeting. And they're engaging and doing more weekly emails to caregivers. So on the next slide, we can point you to places to find some help. In Minnesota, we have the Senior Linkage Line. The Senior Linkage Line is a free information and assistance program for older Minnesotans and their family caregivers to help link them to a local services and to help you find information. The Senior Linkage Line actually created a website called Resources for Older Adults During COVID-19, and the website is helpolderadultsmn.org, and it lists how services have changed in reaction to COVID-19. If you live outside Minnesota, we first will apologize that you aren't in the great state, but I'm sure you love your state just as much as we love Minnesota. There is a national service called the Elder Care Locator, and you can contact the Elder Care Locator simply Googling their name. They have a phone and online chat, and they can link you to your local senior linkage line. Probably won't be called the Senior Linkage Line, but there is a local service in every community across the US that's there to answer questions that you may have. And on the next slide, Liz has some specific tips on how she has been able to continue interactions with her mother.
Yeah, and I think while the formal services are wonderful and we're so lucky that they exist and that there's a nationwide network of these, there's also sort of a strong urge for people to do informal supports and find informal ways to stay connected with their loved ones. And I'm going to give you some tips of things that I've been doing and also what some of my new friends that I've met who are also providing caregiving during this time are doing. And that's a picture of my mom and me talking via FaceTime. And I'd urge anyone to connect often with your loved one. And that's what I've been doing. I was fortunate to be able to send her an iPad. And so we talk over FaceTime. My mom thinks it's a funny experience every time we do. She can't believe I'm on the other end of it. So we do talk by the phone often as well, which she's more used to, but she loves to stay in connection. And this is something that you can, plan out so that you're making sure people are contacting people every day, because social isolation is, bad enough for the rest of the country. But if you're living in a long-term care facility and are stuck in your small room and all of your social activities are cut off that way and you might not understand it, it's even more important. Some places are doing things like window greetings where you can go and talk through a window. So if you live nearby where your parents or loved ones are, you can even have I've seen photos of friends of mine having like a party where mom is inside a window and everybody else is outside on the other side. I think sending activities to your loved one is also a really great thing to do. Thinking about what your loved one likes to do and also what their current capacities are. Would an iPad, I sent my mom an iPad with some of her favorite TV shows on it. My mom isn't a big TV watcher, but she did really love the Bob Newhart show and Mary Tyler Moore and Carol Burnett. So I downloaded those all onto an iPad and sent it to her. And now she's spending a lot of time watching those. That's not her preferred activity, but since her preferred activities aren't allowed right now, this is something that she's doing. For people who might have more advanced Alzheimer's, something like fidget blankets or other sort of activities they can do as well. I think it's really important for people to connect often and plan with your extended family or friends of the loved one if you're fortunate to have that. I coordinated with my brother and sister-in-law and also some of my friends who were visiting my mom, and to sort of set up different times that we call. So we're sure that people are calling every day, or you might have it where, if they're doing it more often, someone calls in the morning, someone calls in the afternoon. And also to think about, contingency planning. So we did that. We talked about what would happen if there was a widespread breakout in the room or in the facility. Like when would we decide to actually take her out or not? So we talked about this ahead of time. Because the workers are really the unsung heroes of the pandemic right now, because we're hearing a lot about the healthcare workers who are doing fabulous jobs, but these folks working in nursing homes and long-term care facilities, often getting paid very low wages, have been choosing to come in and continue to support our family members. And I feel like I can't thank them enough. And they very much appreciate everything. I actually just asked them the other day, what is it that you would want? And they said, just a thank you is enough, but you can also send them small gifts, order pizza, bake cookies and drop them off, to really thank them for they're risking their lives to take care of our parents. If you're like me, I'm sort of an advocate by nature, so I couldn't stand that I saw that the facility my mom was in wasn't letting us know initially wasn't letting us know how many folks had COVID-19. They weren't wearing masks. It was all very sketchy. So I spent a lot of time doing advocacy, and that was when I first started a support group in Washington State, which has maybe 80 people in it. And we sort of organized advocacy at the state level and at the local level. I was calling the mayor, the state representatives, the Washington State Department of Health. My mom lives in Seattle, and really worked hard at getting the state to eventually, we were just a small voice in the pond, but to get them to change their policies to make them more strict. So that can be something that might make you feel better too, that you're doing everything you can for your parents. We do have a support group that Rajean and I are active in Minnesota that has, I don't know how many people are in it, maybe 50 or something like that, people who have family members living in Minnesota, and people outside of Minnesota are welcome to join as well. And it's just a way sort of to give ideas and tips and support for other people who are facing the same sort of situation. And I personally, I go to the support groups of my parents' facility as well, but I like the ones that are sort of cross facility too, so you get ideas about what's been going on other places. And it's a time to vent a little bit too, which I wouldn't do so much when I'm talking to the workers of the facility. And then finally, I think just recognizing the competing responsibilities and stress that people do have. Lots of folks who are, you're worrying, I worry all the time about my mom, but I'm also worried about my 3 children, and I've got a full-time job, and I'm worried about money and all of these things and social isolation. And so this is something to keep in mind. And I just saw a question about getting masks for individuals who can't afford to buy them. That's something that people are doing, is organizing things like mask drives. And I think that kind of activity might make you feel better when you can't go visit your parent every day. These are the sorts of things that you can do that helps your own family member and people in other facilities as well. So that's an idea.
And for also other places you can get masks. On Facebook, I'm part of a number of Facebook communities just for my local city here. And someone once sent out an email saying, I can't find masks anywhere. And another woman said, I'm just sewing them. Anyone who wants one, I'll be happy to give you one. And in Minnesota, the governor actually called for a PPE mask day. And so people could drop off at their local fire department masks that then would be given to nursing homes. And in my city, there were over 1,500 masks donated on that one day, sewn by people across the community, that then were distributed to senior care facilities. So you can do all of this advocacy and community development and community organizing on your own, often just through Facebook and throwing questions out there or requests. People feel helpless, and by sewing a simple mask, or even by giving some money, not to give a plug for the University of Minnesota, but the University of Minnesota has a new mask that you can buy, and it's the University of Minnesota colors. And you think, oh, capitalizing on this. The amazing thing is, for every one you buy, they will donate one to a healthcare facility. And so it's a really great opportunity to try and give back and do a little something. We just have a couple of slides left, and then we'll jump into some of the questions. All of us have become our own local IT departments, we recognize, and using things like Zoom or Skype or Messenger can be confusing. We've done a little chart here of some of the most well-known apps that you can use. And we got this off of Zapier, which is a neat tech website that kind of breaks down technology. So here's a lot of the different options. On the next slide are options that are just for Google. They have their own suite of tools. And there's also a special article. I would just Google text messaging or video text or video chat and select one that works for you. On Easter, I did a virtual Easter. We all had dessert together. There were 20 of us, and it started getting so hectic. Zoom has a feature to create breakout rooms. So I basically created a living room, and I sent 5 people to the living room, and I created a kitchen and sent 5 people to the kitchen. Because when you start getting over a few people, everyone wants to talk because we want that interaction. So just think about how you use the technology. If you ever want to figure out how to use something, the best IT help you can ever find is YouTube. There is a video on YouTube for everything. So if you want to learn Zoom or Skype or FaceTime, just go on YouTube and do help me figure out FaceTime, and you will get a 2-minute video and become an expert. And the last slide that we have is a slide of the sources of information. Liz, do you want to walk through this?
Yeah. So someone had actually asked about where the list of facilities with COVID-19. So this is in Minnesota. So you can find this. You should be able to find this at every Department of Health. State Department of Health is supposed to have a list of facilities. I know they keep changing it. So the 2 states I keep an eye on is Washington and Minnesota, and both of them keep updating over the last 6 weeks or 2 months now, I guess, have updated their sites and keep changing them. So it's all in different places. Minnesota, the second site down where it says situation, that is the one where it talks about the statistics, and it also has the list of all the facilities that have COVID-19. You should be able to find this in each state now. Most states will have this coronavirus hub or dashboard where you can go and look. And so that's what the first one is. That's Minnesota's dashboard. Where it also has rules and regulations, and it has updates on what the stay-at-home orders are and all of the rules and regulations. The Minnesota Department of Health and other states will also have special sites on long-term care, which have the specific rules and regulations for long-term care facilities. And this is where you can find what the rules are about things like cohorting, notifications, that type of information. If you go to the Centers for Disease Control, they also will have the regulations. You'll see that they match each other somewhat with states and CDC, and the CDC has the latest requirements. My editorial opinion is that the CDC's requirements have been slow to catch up with our scientific knowledge of coronavirus, so they've sort of been lagging behind. There have been a lot of there's been a lot of advocacy by health experts, by aging advocates to try to get this, get the regulations better suited to the disease so it protects our family members better, so they are changing. And then there's also the Centers for Medicare and Medicaid. And so all of these are related to each other. So you'll see the Centers for Medicare and Medicaid saying to follow the regulations of the CDC. This is all made it very confusing for facilities who, you can't really blame them, but they're trying to follow the regulations, but sometimes they're meeting the base of the regulations instead of thinking, okay, well, masks aren't required, maybe I should go ahead and require them anyways.
Go ahead, sorry, Liz.
No, I said, I was just gonna say, you can go to these sites and read more technical guidances from these different organizations.
One of the things that's happened in Minnesota that I think is important to acknowledge is that the state has defined an outbreak in a facility as an N of 1, any one person, staff or resident. And so there is sort of an alarming look when you see an outbreak. But I've heard of cases, and I run the long-term care administration program at the University of Minnesota. There's one case where a facility had a quote outbreak but it was a new employee who hadn't even showed up to work yet that had symptoms and actually was tested, and as a result was not brought on site to the campus. But because they are employed by this facility, they are considered to have an outbreak, even though they have no cases of COVID-19 on their campus. So it's important, again, back to thinking about bringing a loved one home, is asking the facility of their cases. There was also a question. Oh, go ahead, Liz.
I was going to say that it's still, I think this is a way that sometimes family members will have to push on this a little bit, because there has been a lack of transparency because of concerns of privacy and HIPAA regulations, that they can't say who it was. I really wanted to know if there are 7 people in my mom's facility. Are they on my mom's floor? Are they my mom's wing? Of course, they can't tell me that, but that's a question, but they also might not be telling you that it's a resident or a worker. They don't have to necessarily tell you that. It depends on what the different state regulations on that. So I would push to get as much information as you can so you can make an informed decision.
Yeah. So there is a question about abuse. Do we think that abuse is taking place more frequently in nursing homes and assisted living now? So one thing about elder abuse, neglect, or exploitation, we hear a lot about it in facilities. And the reason why we hear a lot about it in facilities is that they have regulatory requirements that they have to report. And in a facility, a person often comes into contact with multiple people, and every person that resident comes into contact with is a mandated reporter. So even if you're cleaning a person's room, delivering a food tray, if they see any unusual bruises or scrapes or anything missing from the resident's room, they are mandated by law to report those. So actually the instances of abuse and neglect and exploitation in facilities is much lower than in the general community. About 80% of elder abuse occurs in the community, not in a facility. That being said, we do have added stress, and stress can certainly turn into negative behaviors and aggression. There also may be some inadvertent neglect because of the lack of staffing. In Minnesota, for every 1 job seeker for long-term care, there are 6 open positions. And when you have so many open positions here, for example, many of you probably heard this past week, an assisted living facility had to close because there were no staff. The staff had all contracted COVID-19. And as a result, they had to move all of the residents to other facilities. That's, I think, where some of the neglect is going to come into play. I don't know, Liz, if you have any thoughts or comments on that.
Yeah, I don't know either. I totally understand the worry about it, because that's something that we worry about when our family members are being taken care of people, and we worry about the workers who have their own stress and they're risking their health and life, and they might have families at home too. So I understand the worry about that. And then you can't check on your family member like you would to see if they seem okay or not. So I do understand that stress. I don't know. I would guess probably maybe it could be higher, but we wouldn't, I don't know. I don't have an answer on what exactly to do with it. I'll tell you what I really, that was one of the reasons, another reason, I guess, why we got an iPad, even though that was expensive, was that I could, in my own way, monitor a little bit. When they're helping my mom get the iPad ready, are they wearing a mask? Does my mom look okay? Is her hair combed? Does she look happy? All those sorts of things that you would want to check. That was one way. I thought the video chatting was really, really important, not just for the social connection, but it was just a way to keep eyes on. And also really having, knowing other people who have family members in the facility too, which I didn't before. I didn't make an effort to do that. Now through my support group in Seattle, I know 4 or 5 people who have family members, and we exchange information. Have you seen people wearing masks, and does it look like it's understaffed? Those sorts of questions.
Mm-hmm.
I saw this next question here that asked how accurate are the numbers regarding deaths from COVID-19? The cases for elderly appear high. That, of course, we're not epidemiologists or virologists or biostatisticians, so we're not experts on this, but I just, I think this is a big concern. Are we over-reporting or are we under-reporting? There's arguments both ways, but I just saw something from the Kaiser Family Foundation this morning. I was reading a report that was looking at the normal expected deaths per month per state and the actual expected deaths per month per state. And we're definitely have more deaths, and we've got a gap that we're attributing to COVID-19. So it means that there's other deaths that we aren't accounting for that, and we don't know then right now if where those are coming from. I wouldn't be surprised if older people who are dying actually are making up a lot of those. So maybe the numbers are even swinging higher in other places where people are, people might be just, I know, for example, a family friend whose dad was in my mom's facility who died of a sudden lung disease, and they didn't test him for COVID-19. And this was in March. And I think, well, it sounds like COVID-19, but they never tested him. He won't be counted in the statistics. That's just an anecdote, but I think we really won't know this for a while right now. I don't think the answer is we don't know. Are there other questions? Are we missing any?
I think we've gotten all of them. So you are going to get copies of the slides.
We just got another one we're reading.
Yep. Ah, yes. Right. That is a very tough, question. So I have heard of a very interesting phenomenon that is occurring. Nursing homes need employees and need help right now, and they are hiring. They are hiring people in dietary services. They are hiring people in housekeeping. And there are several nursing homes here in Minnesota that have hired family members. And it's a bit of a loophole in the ability to visit your family member. I mean, obviously you are still an employee. You are required to do work, but they are hiring family members part-time or a couple hours each day to help around mealtime. That might be an opportunity here in this assisted living. I'm not sure if it is, to hire them in a different way. I think the other option that you should reach out to always is the Ombudsman program. If you're in Minnesota, we call them the Office of Ombudsman for Long-Term Care. They are advocates, are residents in nursing homes and assisted living. And those would kind of be the options that I have. Unfortunately, with the visitor restrictions, if a person is not a staff of an assisted living facility, they could restrict visiting to try and prevent the spread of COVID-19. I don't know, Liz, if you have any other thoughts on that.
Yeah, I don't know. I think just overall the issues with staffing and trying to find, I know what it's like to try to find PCAs for people living in the community too, and how hard it is to find a good one, and how absolutely devastating that is when the good one, where an agency won't let the good one come anymore, or they move on to other things, and how absolutely disruptive that is. So I feel for you on that one. I don't really know what to say about that, except hopefully you can find a new one who will be as good. I think it's a really critical, the staffing issue is really critical right now. Really, really critical. And I think it's difficult and it's expensive to have them come in as well. I wish I hope you can find find a substitute caregiver. I see about pets. Yes. Okay. Now this is probably really beyond our expertise, is knowing about pet to human transmission of COVID-19, but I know lots of facilities do have pets. My My mom facility has a big, huge, hairy dog named Moose, who's the mascot of their facility. And I don't know, you know, what I've heard so far is that the transmission they think is going from the humans to the pets, but I don't see why it couldn't be the other way around either. But this is way beyond my knowledge of virology. But it would be something I actually hadn't worried about that with Moose before, if he was spreading the COVID-19 through my mom's facility. Yikes, another stress. It's very stressful.
Yeah. I know that there are facilities that are limiting human-animal interactions, and in fact, some facilities are having the facility animal go home with a staff member and not bringing the animal back into the facility just because it's unknown. So
I thought somebody just sent a link on this, so you can read this and hopefully get better answers than I can give on this.
The question, sorry for those of you that were listening, there were two questions we answered there. One was that an individual had a PCA visiting their father in assisted living, and the PCA was not an employee of the assisted living. And the assisted living is saying that that PCA cannot come in because they can't control as much of what that PCA does and where that PCA goes. And it's been a vibrant, vital part of their father's life. And so what to do. And the second question was related to, there are some news that has come out about pets testing positive for COVID-19, and there are a lot of facilities that have them. So those were the two questions, but thank you. I just want to say thank you to everyone for joining us, and just keep in mind that we've had 226 people across the US join us for this webinar. We are all in this together. We are staying safe at home as much as possible. And we have great minds across the globe working on this, great geriatricians thinking about older adults and policymakers. And we have to continue to be vigilant for our family members and friends during these uncertain times.
Yeah, and anyone's welcome when Joe sends out the slides today. You can feel free to join our Facebook group. It's just a casual, informal group where you might be able to ask some of the questions that you might think about later on today. And, you know, about, you know, or just say like, hey, I need ideas for connecting with my parent, or I'm really worried about a positive test, you know, or start one up in your own state. It's another way to get support.
So I'm trying to copy that link because the link was just sent to panelists, and I accidentally put in a link for this Zoom meeting. So don't click on that one, but maybe Joe, you can put the link for the one for the health department to the coronavirus, send it to everyone, to the attendees and not just the panelists.
I will send that out to everyone afterwards.
Okay, so you don't want to come back in the Zoom. We're ending it. So, but
yes.
Thank you all.
On behalf of the Center for Practice Transformation, we'd like to thank you all for joining us from all across the country today. And we'd like to extend an extra special thank you to Doctors Liz and Rajean for sharing their time and talents and your personal stories, which are so powerful. You're right, we are all threads in the same blanket. And take a moment to look in on a senior this weekend. Thank you all for joining us.
Thank you.